Good evening and welcome to this special edition of Cronkite News on Arizona PBS. I'm Raven Payne. Thank you for joining us. Tonight we're taking a look back at stories from our health team, from new federal funding to help downwinders to how Sky Harbor Airport is helping those who might need a little more patience.
In the mid-20th century, the American West was used as a testing site for nuclear weapons. The impact of those tests is still being felt by thousands of people who live downwind of the test sites. Raven Payne tells us about a new effort to help more people exposed to the toxic winds before time runs out.
As the wind blows in Kingman, Arizona, Eddie Patillo is reminded of what traveled with it in the 1950s and what it has cost him.
Serious cancer.
The United States conducted close to 200 nuclear weapons tests from 1945 to 1962. Patillo grew up in Kingman, and the shadow of those tests hung over him throughout his childhood.
I was a lifeguard at Catherine Landing in Bullhead City, and there were a bunch of government people who had Geiger counters and things that came in with swimming after the test went off.
This playground at Palo Christi Elementary School, now closed, is where the late Sharon Patillo said she saw the mushroom cloud from across the hill, over 150 miles away. The kids thought the blast was exciting, but there's so much more to it than that. Those clouds carried radioactive material hundreds of miles to the neighborhoods of Patillo and thousands of others. They're part of the downwinders, people who experienced ill health because they were exposed to the fallout from Nevada nuclear tests.
In 1990, Congress established RECA in order to allow people that lived in the area some compensation.
Currently, residents in 5 Arizona counties are covered by the Radiation Exposure Compensation Act, or RECA, but parts of Mojave County, the part that includes Kingman, was left out for reasons Representative Paul Gosar says was not intentional.
But it was an administrative error, and we tried to correct it every which way but loose.
The Downwinders Parity Act was introduced in late 2021 to fix this error and expand compensation to all of Mojave County, Arizona, and Clark County, Nevada. According to Representative Greg Stanton, this bill is about more than money.
It's about the United States government acknowledging that they did wrong to these families and saying to these families, we see you, we understand the pain that you're going through, we care about you, and we want to make sure that you receive justice.
For Kim Patillo, she just wants help for the dad she loves.
He's just in a lot of pain. I mean, we spent, was it last Sunday, in the ER for 6 hours because he had huge amount of pain.
Eddie Patillo is currently battling colon cancer. He's also survived bladder cancer, both types covered under RECA. But because Patillo lives in Kingman, he has to pay for treatment on his own. According to his family, so far, they've paid $12,000 out of their pockets.
You know, what to do when he goes away, and that's just not a conversation you'd like to have.
But Patillo isn't dwelling on his illness.
This is a Joshua.
He still finds time for projects around the house.
But I never let the disability of the illnesses slow me down much, I don't think. Except I have to use a cane now.
He's still living his life with the wind at his back. In Kingman, Raven Payne, Cronkite News.
Valleywise Health in Phoenix is now receiving the help of U.S. Navy personnel in the ongoing fight against the COVID-19 pandemic. Cronkite News reporter Madison Thomas is at one Valleywise facility now.
Right now, there are over 1,200 military personnel working alongside healthcare workers across the country. Last Wednesday, 7 members of the U.S. Navy arrived here in Phoenix. The Federal Emergency Management Agency and the state requested assistance for support in handling COVID cases. After arriving last Wednesday, the team became fully operational on Friday and is currently slated to be here for 31 days. The state saw its peak in case numbers in mid-January during the latest surge. And while we have seen a decrease in percent positivity, COVID is very much still here.
We still see positive COVID tests. We still see individuals that are coming in complaining of symptoms, complaining of having that COVID-19 disease around this. What has truly helped us is all of your efforts to continue to have our folks, follow those safe practices.
Our medical knowledge and experience, coupled with that of the Valley-wise hospital staff, will prove invaluable as we work to tackle the massive residual burden of COVID-19 pandemic on the hospital and the local community, and assist in providing care to those who need it.
Dr. White says they are grateful for the relief and the much-needed support for their staff. In Phoenix, Madison Thomas, Cronkite News.
The point-in-time count for homelessness took place this morning in Maricopa County after a year's hiatus. Cronkite News reporter Raven Payne joined the count coordinators as they surveyed people experiencing homelessness and tells us why this event is important to those communities.
The counts took place across the valley from the city of Chandler to the city of Phoenix. The last time there was a point-in-time count in 2020, they counted just over 7,400 people experiencing homelessness in Maricopa County. Just based on what we saw this morning, our count volunteer says there were less people out than previous years. Volunteers gathered early this morning to survey and count the number of people experiencing homelessness. These surveys included simple questions in order to better understand the resources people experiencing unsheltered homelessness need. Although the COVID-19 pandemic put a stop to the count, Community Bridges Senior Director of Housing and Community Integration, Elizabeth DaCosta, says there was a silver lining to the forced break.
As far as it relates to homelessness services, COVID-19 shed a spotlight on the public health crisis that is homelessness, right? That people, while we were all kind of staying at home, there were people out there that had no place to go. They were surviving on the streets and had nowhere to go. So because of that, we got a lot more resources coming into our community.
According to DaCosta, the count helps with the allocation of funds to communities, emergency shelters, and other resources. The preliminary numbers from the 2022 point-in-time count should be out by the end of February. In the newsroom, Raven Payne, Cronkite News.
The volume of cases has put a strain on testing sites across the state. In an effort to tackle this issue, FEMA partnered with Pima County to open a large-scale testing site in Tucson. Cars upon cars wait in lines for COVID tests here at Pima Community College West Campus in Tucson.
It looks like right now they can still make same-day appointments for testing if they need it.
Anthony Gamino with the Pima County Health Department says they had some struggles in getting at-home tests to residents.
There just wasn't enough inventory, so after the first of the year, we had to stop the distribution at the library sites.
This has been a problem for health departments across Arizona. This new testing site in Tucson opened after FEMA agreed to fund the new drive-through center.
We were pretty early in our ask and pretty persistent, so you throw all those things together, and that's why FEMA was able to start this 3-week testing pod here in Pima County.
The community college site is the only one funded by FEMA so far this year. It features self-swab tests at the moment, and appointments are preferred.
Print their reservation confirmation because the vendors need that actual printed piece to hustle along and keep the line moving.
According to the Arizona Department of Health Services, there are over 600 locations statewide to get tested for COVID-19. There is now a new site at State Farm Stadium, and Pima County opens another testing option today.
Opening up a site Tuesday, January 25th, at the Keno Event Center, which is in cooperation with one of our testing vendors.
Officials hope with this new testing site, they will be able to catch cases earlier and stop the spread of COVID-19.
COVID-19 is a concern on college campuses as well. Universities are implementing COVID-19 protocols to keep students and staff safe as the spring semester starts. Some are requiring masks indoors, while others have stricter rules. Karen Marroquin reports from our Los Angeles bureau. She explains why many California universities decided to require vaccinations and why it may differ from what we see here in Arizona.
We have a requirement that as of January 31st, people who are eligible, meaning they've had their 5 months pass, in the case of most vaccines, 2 months for the Johnson & Johnson, people are required to have that booster dose as well.
USC is one of the many universities in California that has required their students to get their booster shot before returning to classes this spring. Located in the heart of South LA, USC's mitigation tactics go beyond just protecting those at the university.
We have an opportunity to not only protect the people that are part of USC, but everyone who is the Angelenos around us.
And it's not just USC. Universities all over Southern California have implemented their own safety measures, such as completing a return to campus training and taking their temperatures every day. California State Northridge student Joshua Rhodes is on board.
You have no idea what some people's health factors are, and it could affect the virus could affect many people in many different ways.
But there has been resistance to school rules. Just 2 weeks ago, a student sued the Santa Monica Community College District, and their lawyer calls the rule unconstitutional. In Arizona, college students at ASU and other state universities weren't required to be vaccinated against COVID-19 this spring, despite the surge of cases in both Arizona and California this winter. Will Humble, the executive director at the Arizona Public Health Association, says a lot of it has to do with local politics.
In Arizona, we've got a governor that's micromanaging universities and making it nearly impossible for them to implement these kinds of mitigation measures.
We reached out to the governor's office for comment and did not receive a response. At the end of the day, even though some have been hesitant in accepting this mandate, Humble says that the answer to requiring vaccines or not is clear.
You can have fewer disruptions in research. You can have better attendance by the students. You have better likelihood of being able to run in-person school. So there's enormous advantages to requiring vaccines in an academic environment like that.
In Los Angeles, Karen Marroquin, Cronkite News.
A letter penned by over 1,000 Arizona healthcare workers has been sent to Governor Doug Ducey, lawmakers, and other health system leaders in our state about the crisis they're seeing because of COVID-19. Cronkite News reporter Nick Shesky spoke with one of the co-authors of the letter to find out more about the situation.
Last December, 1,315 healthcare workers from across the state of Arizona co-signed a letter stressing the urgent help that our state's healthcare system needs. After hearing no response, the letter was resent earlier this week.
Since the time that we originally sent the letter and now, we have continued to see worsening case numbers in the state, increasing hospitalizations, increasing ICU bed utilization, and so on.
The letter says the Arizona healthcare system is in a crisis and that the current situation is unsustainable and that the system is already starting to collapse.
We have patients who are waiting in the emergency department for more than a day in order to get an inpatient bed or an ICU bed. We have patients who are in the hospital who we aren't able to discharge to a skilled nursing facility because they don't have room available because their staff are out sick.
In the letter, the healthcare professionals call for Arizona leaders to mandate mask use in indoor public spaces, supply free high-quality masks, and to urgently increase the testing availability and accessibility, among other requests. In a press briefing this week, Banner Health said that they are feeling the pressure of the pandemic.
Throughout the pandemic, Banner Health, like all other healthcare systems throughout our country and throughout the world, have intermittently experienced shortages of different types of supplies.
Experts expect the peak of hospitalizations from Omicron to be in early February. So unless there is any mitigation from Arizona leadership, the worst is yet to come.
We still need mitigation measures in place in order to try and curb transmission as quickly as possible to prevent needing to triage resources for our patients.
The governor's office sent Cronkite News this statement, which reads in part, "We are eternally grateful for Arizona's healthcare workers who have fought so hard to keep us safe." The governor continues to work with the Arizona Department of Health Services and healthcare professionals across the state. In the studio, Nick Shesky, Cronkite News.
Today, the American Lung Association released the State of Tobacco Control report. Cronkite News reporter Liz Flores explains how Arizona is doing from preventing the youth getting addicted to tobacco products.
I consume tobacco on a pretty much an everyday basis. Either it was smoking cigarettes or e-cigarettes or just like the nicotine patches.
Alex Munoz says he started smoking when he was 14 years old.
Me and my friends were just walking around and we found some cigarettes.
According to the American Lung Association, over 13% of Arizona adults are smokers. Munoz is among them.
Definitely a concern
for us here in Arizona.
Struthers says the tobacco industry markets its products to certain groups.
African Americans get targeted with menthol products. Our LGBTQI community gets targeted with certain products. Just teens in general.
The report indicates that the high school tobacco use rate in Arizona is over 20%, while the middle school smoking rate sits at over 2%. The State of Tobacco Control report gives Arizona an F for funding of state tobacco prevention programs, an A for strength of smoke-free workplace laws, but an F level of state tobacco taxes, and a C for coverage and access to services to quit tobacco. Struthers says the American Lung Association calls for action to stop underage smoking.
Trying to get a tobacco retailer license passed. Arizona is only one of a handful of states that doesn't have one. So right now in Arizona, we don't even know really who can sell tobacco, who's allowed to, and who's doing it.
Munoz knows the dangers of smoking as he's tried to quit before, and he knows quitting is something he wants to eventually do before it's too late.
As of right now, I just don't see that happening at the moment, but the plan is to stop.
In Phoenix, Liz Flores, Cronkite News.
In light of City of Phoenix Mayor Kate Gallego's efforts to make Phoenix a dementia-friendly city, Sky Harbor Airport has started a few initiatives of their own to make traveling easier. Cronkite News reporter Raina Preciado went to see a tour explaining the details behind these initiatives.
Airport staff showed Mayor Gallego the many initiatives that can help ease those with hidden disabilities. One of the programs is the Compassion Cacti Lanyard program.
When they see this Compassion Cacti Lanyard, it's a sign to share resources such as the Compassion Corner.
Mayor Gallego was guided through the Compassion Corner. Customer Service Manager MISTY CISNEROS-CONTRERAS says the Compassion Corner is
a space that is multifaceted to offer unique opportunity for those with sensory challenges to get out of the hustle and bustle of the airport and regroup.
Even the smaller details contribute to the comfort of those making use of the space.
We've selected special tones of the paint to make sure that it's very calming.
It also includes seats similar to those on an airplane to help people feel more comfortable when they get on board. In Phoenix, Raina Preciado, Cronkite News.
That's it for this special edition of Cronkite News Tonight. Thanks for joining us. For top Arizona stories anytime, go to cronkitenews.azpbs.org.
Break It Down is brought to you in part by Mayo Clinic and viewers like you.
Professor David Rice, thank you for joining us to break down the MLB All-Star Game, leaving Atlanta to go to Colorado and what that means.
Oh, it's my honor to be here with you, Professor. Good to see you.
Let's start broad. Sports and protest. Is that a good combination?
Oh, yeah, I think absolutely it's a good combination. Sport is such a significant part of life and expression of identity that to not be able to express and outline the contours of what's happening in society without it taking place in sport, I think is largely irresponsible. I think of sport and protest as a part of eradicating any ill that exists in the world and using a platform to do so. So I think sport is a significant bully pulpit that can be leveraged to the greater good.
So apart from the specific topic, we're going to talk about the MLB All-Star Game. Why are people so stressed when athletes or sports entities decide to protest or take action?
Of course, it all depends on who you're talking to. I think if we're going straight down the line, a lot of folks articulate frustration and stress because individuals' social or sociocultural views are getting in the way of their entertainment, And so a lot of folks that you've heard, right, just shut up and dribble, or just, I don't want to tune in to hear all this extra stuff. I just want to be entertained. And I think that you hear that a lot of times from the individual or the viewer or the sport observer as someone who is removed from the lived experiences or the life of the people who are engaged in sport. you know,
Right.
and certainly we know that sport is an entertainment enterprise, multi-billion-dollar enterprise. But we also know and understand sport as being an extension of and an expression of cultural values, cultural dictates, and cultural orientations. Oftentimes it's not thought of as that, but if you're talking about Black and brown folk, Black folk in particular, when you're talking about sport, it's a way to be free. It's a way to be unencumbered by societal restrictions that you might encounter. So, you know, it might simply seem like running a 100-yard dash or something like that, but there's a freedom that's associated with that. And I think that a lot of times that's not taken into account.
So why this time? I mean, and what you set up, I completely agree with, obviously. Why this time did MLB take action that we traditionally would not think that Major League Baseball would take?
We're in a particular time right now, right? So we're in a zeitgeist where you've got either, excuse my colloquialism, but you've got to either get down or lay down. So you have all of these other sport entities. You have women's basketball, you have National Basketball Association, you have the National Football League, all doing some type of mea culpa for their players around having missed the boat in terms of addressing sociocultural ills and malignment that's othered Black and brown people. And so when you have this law that's put into place that restricts individuals' democracy, and it's so blatantly done, it's difficult to turn away from that. You know, when you were talking about having it in Atlanta, the crucible, the cradle of the civil rights movement, you're talking about having it in Georgia, a place where Hank Aaron lived and where Jackie Robinson was born, where we know that so much civil rights activism has been birthed. For Major League Baseball to turn a blind eye for that would have been very difficult to do.
What's your gut feel? One of the feelings was that Rob Manfred decided to pull the game because he thought some of the players might boycott. What are your thoughts on that? You mentioned this is a special moment in time. Do you think baseball players were at the point where they would have done that?
I hope they were. I can honestly tell you that my finger's not on the pulse of what the players would have done in Major League Baseball, to be quite honest. But I do think that the decision comes because there is more and more, not necessarily pressure, but there's a freedom that I think athletes are feeling now in terms of being representative of their community. And as you see that, there has to be some awareness around what the response will be from a governing organization of players. So the idea is that it's not quote unquote business as usual, considering the times that we're in now. We're talking about voter suppression laws being signed by Brian Kemp here in Georgia when the state turned on less than 10,000 votes. And so when you're talking again about taking away voting rights, which is cornerstone of the democratic process, then somebody's going to say something about this if we go on with business as usual here. One of the things that's been so interesting in looking and taking the temperature of athletes over the last 4 to 5 years, athletes are feeling more emboldened about who they are as individuals. You know, what they do in terms of sport, again, is an expression of who they are. It might even be a quote unquote job, but it's not one that's going to eclipse their responsibility and connection to community. And I think that's something that, again, folks who are commissioners of these leagues have to be aware of.
In the pantheon of sports boycotts, I've got some for you. We had the 1993 Super Bowl that did not take place in Arizona because of the state's lack of compliance with celebrating the Martin Luther King holiday. We had the 1980 Olympic boycott. And we also had a 1965 boycott of the American Football League All-Star game that was to be held in New Orleans, but they ended up moving to Houston because Black players were being discriminated against. Where does this one stand in that pantheon?
I don't know, but I think that certainly it is going to be in line with those boycotts. Again, the times that we're living in, we're in such unprecedented times, right? We're talking right now about a boycott that's taken place in Georgia because of voter suppression. We're talking just months after there has been armed insurrection on the U.S. Capitol. We have in Minnesota as well, a brother who was just shot down and killed mistakenly by a police officer. So you have all of these collateral images and experiences that are taking place. You know, you have Breonna Taylor, you have Ahmaud Arbery, you have this marginalization and violence against Asian Americans as well. So you have all of this mix of sociocultural violence that's taking place. I think that this removing the All-Star game from Georgia is the right thing, right? But it almost is minuscule because of the storm that exists during the time. Looking at how it is that it lines up with several other things, you're almost compelled as a commissioner to say, okay, we're not doing that because it just doesn't need to be done. And you kind of just check that off and move to Denver. It sounds light. I know it's heavier than that, but because of the times we're in, you just can't go down that road. So matching it up against past experiences that have been similar to this is difficult to do because the times are so very different.
Oh, okay. No pressure. I appreciate it.
Did I get out of that one okay?
No. You've taken us to a Morehouse classroom. We appreciate that. Professor David Walrice, thank you so much for breaking down for us the move of the MLB All-Star Game from Atlanta to Colorado.
Thank you. It's been a pleasure. Appreciate you, brother.
This hour of local news is made possible by contributions from the Friends of PBS, members of your PBS station. Thank you. If you have comments about Arizona PBS News, please contact us at one of the addresses on your screen. Thank you.